All right.
Thank you. I have a script I'm going to read here for the Education Committee. Hello, I am Patsy Zeller and I serve as Chair of the Education Committee of Kansas State Board of Nursing. I ask the members of the Education Committee to respond to a roll call signifying their presence at this remote open meeting by Zoom and YouTube. Juliana Resnick.
Present.
Andrea Watson.
Present.
Christina Rudisil.
Present.
Dee Bonifast.
Present.
Amy Ha.
Present.
Michelle Bertashaw.
Present.
Is that how you say your last name?
Yes, correct.
Thank you. I also ask the following board staff members to signify their attendance. Carol Moreland, Executive Administrator.
Present.
Janelle Martin, Nursing Education Compliance Officer.
Present.
Michelle Brown, Education Secretary.
Present.
Public comment allows individuals to address the Education Committee about their concerns. However, the Kansas Open Meetings Act, which is known as KOMA, does not require the Education Committee to provide public comment or answer questions from individuals. Public comment will not be taken today because there is a possibility that the connection for this remote meeting may be lost over time and the time for the meeting may not allow everyone who is present to comment. Additionally, we will not know what comments an individual may make, and we would want to provide notice to the public of our intent to discuss a particular matter so that the public may listen and observe our discussion. However, representatives from each nursing program will be allowed 5 minutes total to provide feedback when the committee discusses site visit reports and curriculum change requests for their representative nursing programs. Because we are conducting this public meeting remotely by Zoom and YouTube, I state for the record the following information. On November 29, 2021, the board sent notice to the meeting for the Education Committee to all individuals who have requested notice of the committee's meetings. Additionally, the notice and agenda were posted on the board's website, ksbn.kansas.gov. You may obtain a copy of the notice and agenda at that website or by sending an email to Carol Moreland at ks.gov with the subject line request for the agenda, and the board staff will send it to you. The notice contains the internet links to access the meeting by Zoom and YouTube. The notice will also contains a Zoom telephone number to attend this meeting by telephone call. All of these electronic mediums allow the public to attend the meeting free of charge. The notice also advises individuals to contact the board's office at 785-296-2967 if they experience any technical issues during the meeting. The only mediums for interactive communication offered for this meeting are the connections by Zoom and YouTube, as previously stated. Each member of the committee, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when participant is not speaking. Each motion will clearly be stated before the committee votes, and the chair will announce the results of the final vote. A statement or motion will clearly identify and authorize by delegation each member of the committee or staff who will be permitted to sign any document on behalf of the committee. The meeting is being recorded and the recording will be posted on the board's website. The committee has the following items on the agenda: call to order, review of on-site packet, additions or revisions to agenda, announcements, approval of minutes for the meeting held in September 2021, Nursing Education Compliance Officer report, executive session if needed, site visit reports, new business, unfinished business, petitions, agenda for the committee meeting in March 2022, and adjournment. The above list of agenda items includes an executive session. If the committee elects to exercise the option to go into executive session, the committee will follow this process. First, the committee must be in an open session before going into an executive session. Then a motion will be made and seconded pursuant to KSA 75-4319B. The motion must contain the statement of justification for closure, the subject or subjects to be discussed, the time and place when the open meeting will resume. If a motion for executive session passes, the public will be excluded from this portion of the meeting as the executive session will be conducted by electronic means that will not be made available to the public. The committee members will return to the open meeting after the executive session. The open meeting will resume when the committee members return to the Zoom and YouTube meetings after the executive session. The complete motion for an executive session will be recorded in the minutes. The meeting is now called to order, and the committee will now consider the next item on the agenda. And the next item on the agenda is the review of the on-site packet.
Madam Chair, Janelle Martin, Education Compliance Officer. There is no on-site packet this meeting.
Okay, thank you. Additions or revisions to the agenda?
Madam Chair, Janelle Martin, Compliance Officer again. I'd like to add an agenda item for clarification on the approval status for Fort Scott Community College.
Okay, let's add that to the last of the site visit reports. So
Okay.
that would be H.
H, thank you.
Yes. Any other additions or revisions that we need to the agenda today?
Not that I'm aware of.
Okay, then we'll move right to announcements. Do we have any announcements? Okay, right on to approval of minutes then. Did everyone have a chance to look at those minutes? Yes, we did. I see a lot of heads nodding. Any changes, anything we need to look at for Michelle to help us with?
Madam Chair, do we need a motion for the revision to the agenda?
Probably so, except the agenda as we've amended it. That's probably right. Do we have one of those?
I believe so.
Yes, I have one.
Hey, Michelle, you're just going to have to interrupt me. If you have a motion that I've skipped over, just interrupt me anytime, not a problem. Hold your hand
Okay.
up, say whatever.
I can do that.
To read that motion for us for the agenda then.
Sorry, the alarm started going off in the office.
Hey.
Yes. So, is there a committee?
Do you need
Is
to
there a
leave for
committee
10
member
minutes?
that would like to make the motion? I move to approve the December 14th, 2021 edition Education Committee meeting agenda as revised.
Madam Chair, I so move.
I will second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. That motion carries. Michelle, do you need to leave the building?
Madam Chair, this is Chelsea. I can take over for Michelle so she can leave.
Okay, Michelle, we'll let you
Thank
go.
you.
You're welcome.
Bye.
Oh, boy. Okay, so I guess we'll move to the approval of minutes. That was exciting. Okay.
Thank you, Chelsea.
No problem. I'm going to kind of wing it here until I can pull up my email.
We'll let you pull that up. Go ahead. We'll give you
Okay.
there. Written motions are not something I can wing, so we'll get it pulled up.
I think she sent them to me. Is there a committee member who would like to make the following motion? I move to accept the minutes as written for the September committee meeting, Education Committee meeting.
I will make that motion. This is Christina.
A motion, do I have a second?
This is Dee. I can second that motion.
Thank you. Motion and a second. Any discussion? All in favor say yes.
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 All
Yes.
opposed say no. Looks like that motion carries. Thank you for that, Chelsea. Well, that's been exciting already. We've only been doing this 10 minutes and wow. Okay, I guess we're headed to the Nursing Education Compliance Officer report. That's you, Janelle, right?
Yes, thank you, Madam Chair. Janelle Martin, Education Compliance Officer. I would just like to make a note of welcome to Dr. Michelle Birdshaw to our Education Committee. I believe this is her first meeting. And maybe just to say a word of appreciation to all the education committee members at this point. You'll note in my report later that they did a lot of work this quarter in helping with site visits. So welcome, Michelle, and thank you to the rest of you. I think the main part of my report, there were a couple of nursing program updates. Manhattan Area Technical College, Kim Davis has been the interim. And October 1st, she was named to the Dean of Nursing Education and Health Programs as a permanent position. So we welcome Kim to those ranks. She's been faculty since 2010 there and has been doing a great job in her interim role. So Heston College also has a new director, Greg Schroeder, who has been serving as interim also and was the interim during their site visit this time, has been named as the full-time program administrator for Heston College. Also, I wanted to make just one quick announcement, didn't make it to the report, but the LMHT program, for those of you who know about it, has been put on hold again. They've run into a lot of staffing issues due to COVID and have had some trouble there. So they have put that on hold. And I just I needed to put that in the report and it got missed and I apologize for that. This quarter, I think the main thing you'll notice there were 9 site visits completed. It was a lot. And I thank you to all the board members who did help with those. And for the sites that we did visit, it went very well. It just was a lot. I think we had one every week. We did 9 visits, 2 were virtual. One of those was planned as virtual. CCNE is still doing their accreditation as virtual. So that was planned. And then our RNA program in Wichita, COA decided a couple of weeks before that meeting to change it to virtual. So we did end up doing that one as well. Both went quite well. And I will add that even the accreditation site visits that we did on site, the use of the virtual resource room, even when we aren't doing a virtual meeting, has been very, very helpful to site visits and getting a lot of that documentation ahead of time. And it's helped both myself and I think the visiting board members help do it. It just creates a much better and easier on-site process and able to focus on the interviews and things and rather than struggling to get all the documentation done. So I just wanted to make that note that that's been a very helpful process, even when doing on-site. Most of the activities are pretty much the normal. I will say that doing faculty qualification reports on top of the 9 site visits, there were a lot. And I know a lot of you have struggled getting additional adjunct faculty with smaller numbers in clinical. I know a lot of programs and a lot of turnover has happened for programs. So kudos to the administrators for getting all those in. There were almost 150 this quarter. So there was a lot happening. I think one thing I will make note, our NCSBN core data annual report that we did in conjunction with them, we presented the Kansas data in September. NCSBN is still working on the annual report that compiles the data for their 9 core. They did do some of the analysis on the COVID data. That has been put out there in an article that they did and a brief that they did on that COVID information. I was going to try and get that link in there, but I didn't get it in time to get it into the report, but I will send that out to all the administrators. I think that's an important thing. And it is on their website, but I'm still waiting to hear when we'll get the final data for the comparative data report. One note too, also for NCSBN is they have a new website for all things NCLEX. So that has moved from their website to its own. Very nicely done. All the registration information, how the NCLEX works, test plans, everything that has to do with that testing process for both administrators, students, anybody who's looking for information there. And it's just nclex.com. So I think that's been a great addition, lots more resource, good FAQs there. So I think the rest of the report is just regular. People can look that over. I don't think I have anything else to bring to your attention. glad to answer any questions if you have them.
Any questions for Janelle? Okay,
That concludes my report then, Madam Chair. Thank you.
thanks, Janelle. Guess we'll move into the next piece. That's the site visit reports. And the first one that we have is Garden City, where I'm from. So I'm gonna turn the meeting over to Juliana so she can handle that while Janelle reads our report. So Janelle, I'll let you do Garden City.
Okay, thank you. Our first visit was with Garden City Community College, the ADN level of the program. I did that visit along with Dr. Karen Kidder, and we did that on September the 9th and 10th. The report starts, I believe, on page 10 in your packet. Strengths of the program, overall, a very strong program. Students are very complimentary of the dedicated student-oriented faculty and their wealth of experience. They feel like they get a lot of benefit from that. Some of the comments, they want us to succeed. There are no dumb questions. They're still in practice, so they know what they're talking about. And they steer us to resources for personal situations and very good communication between students, faculty, and staff. They have very close working relationship with Garden City, the college itself, and St. Catherine's Hospital, which is their main clinical site. Students feel very welcome there and part of the nursing environment. Speaks a lot for that clinical site also. Simulation and skills labs well laid out with appropriate equipment for students to care for simulated patients, including a medication administration system, which is very nicely done. Patsy Zeller, who is the administrator, is extremely organized and passionate about the programs and the students. She encourages and supports faculty in pursuing their academic and scholarly interests as well. There's a full-time student support specialist for the nursing program that does the advising for pre-nursing, which helps those going into the program feel very connected and supported as they enter the nursing program. Excellent faculty providing adequate space for student learning and collaboration. Couple of opportunities to improve the use of the advisory committee. The minutes are present but lack a specific attendees list. It's not really, we weren't really able to tell how involved all the different members were. And there were a lot of different people who did support that particular meeting. Consider changing the minutes format to provide documentation of issue and follow-up and resolution. And also an opportunity to modify the format to the faculty minutes to ensure specific designation of who's responsible for each action item. The systematic evaluation plan saw several years of trended data, did not always see the specific connection to use of data for program improvement, although we did see lots of program improvement just to get that written connection. We also saw an opportunity for the director to be provided with dedicated administrative support. The administrator also works with other programs and has responsibilities for those, and there's not a dedicated person for the nursing. And so the faculty and the director absorb a lot of that work. In terms of recommendations, only recommendation we had was to recommend reapproval of the ADN program for a time period consistent with accreditation.
We need a motion for that, is that correct?
Yes, there should be one for that.
Is there a committee member who would like to make the following motion? I move to accept the site visit report for Garden City Community College ADN program with a recommendation for reapproval of the ADN program for a time period consistent with national accreditation.
Madam Chair, this is Dee, and I so move.
Thank you, Dee. Is there a second?
This is Christina. I will second that.
Thank you, Christina. All in favor, please signify, or I guess I should ask, is there any discussion? Okay, all in favor signify by saying yes.
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 Any opposed, same sign. Motion carries. Madam Chair, I'll turn the meeting back to you.
Thanks for that. And you can put down that I abstained from that vote. So Okay, the next on the list for us, Janelle, is Kansas City, Kansas Community College ADN program.
Okay, thank you, Madam Chair. We did a site visit with Kansas City, Kansas Community College on September 21st and 23rd. We did that site visit in conjunction with ASIN. We were both ASIN and Ksbn were present on site. We did both review of ADN and PN, and we will get to that, but this is the report for the ADN program. And I did that visit in conjunction with Debon and Blessed. Let's see. Strengths identified for the program. We did see a tremendous amount of teamwork and collaboration occurring at several levels of the program. From the president to the dean of health occupations, the dean to the director of the nursing education, which is Susan Anderson, the director of nursing education to all faculty and their advisory council, faculty to general education faculty. There's a lot of good communication there. And then the support of the program itself by the administration, faculty, staff, and the faculty's support of and faculty and staff support to students. The director of nursing education, Susan Anderson, there were many mentions of her leadership during a very important transitional time for this program. Her positivity and work ethic in addressing major and very needed changes to curriculum and the nursing programs, and her communication and open ear to communities of interest were noted several times. Faculty support for students and student learning. Students see instructors as being caring and invested in their success. They feel all faculty, staff, and support service are in place to help them succeed. The program provides a quality experience for students. This comes from them. Many picked Kansas City, Kansas Community College for the location and affordability, but have found it also to be a quality experience that they would definitely recommend to family and friends. There's a longstanding relationship with clinical partners in the area. There is support services for students. Students were very vocal about the great help they get for financial aid and their activities, or their student support services office, and actually just the whole KCK community. Professional development for faculty. There were multiple resources and opportunities for professional and personal development that the staff mentioned, and that we saw in minutes and follow-up. Their faculty ownership and all aspects of the nursing program, they're all very involved. Support and salary for clinical adjuncts is very competitive, and they're able to get strong adjunct faculty, which has been beneficial to the program and the students. Some opportunities identified: the systematic program evaluation plan, the end of program student learning outcomes were well defined and are important, but also important to track all the other aspects of the program. And there's an opportunity to expand that program evaluation plan to include all program areas, and also to make sure follow-up is happening and being documented in that plan. We saw several places where improvement was being made, but not always directly linked as part of their systematic evaluation plan. They did have information about the possible licensure denial on the application, but it's not specific to KSA 651120 and does not reference it directly. They had a couple of broken links. So we just recommended that maybe they make that a more direct and a little stronger language to let them know that that statute it can be linked to that particular issue. Ensure library is following nursing department procedures for nursing resources being no more than 5 years old and less of historic significance. Several books pulled from the shelves were older than 5 years. There was discussion that the nursing program had been over there to do some of that, and that maybe some of it got put back on the shelves. So just a recommendation that that policy get relayed more strongly to the library folks. And a process to ensure all KSBN required information is in faculty files. There is orientation documented since 2017, but many are not signed and dated. We just said there might be an opportunity to consider adding that so that it is considered complete. Recommendations, and a reminder that recommendations are based specifically on statute and regulation, would be to add the language on KSA 651120 to the documentation that's available prior to admission to clearly reference that statute. Ask for that documentation to be submitted by March 31st of 2022. Update the systematic plan of evaluation to include all program areas with goals, dates, data, actions, and review, and to submit that documentation by June 30th of 22. A little longer for that because the program evaluation plan does require some little more extensive work. And then we recommend reapproval of the program for a time period consistent with national accreditation.
Okay, thank you, Janelle. Have another motion, Chelsea?
Is there a committee member who would like to make the following motion? I move to accept the site visit report with recommendations for Kansas City, Kansas Community College ADN program and reapproving the program for a time period of national accreditation.
This is Juliana Reshik, and I'll make the motion.
I have a motion. Do I have a second?
This is Andrea Watson. I'll second.
Thank you. Motion is second. Any discussion? Hearing none, all in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Next one, Janelle, is the PN program for Kansas City, Kansas.
And I might just mention to board members that we do have all the administrators available if there are questions, just so you know, we can get them moved over to talk with you if you do have questions. Forgot to mention that at the beginning. Okay, for the Kansas City, Kansas PN program, it was also, I did that in conjunction with Devon and Blessed. Strengths identified, I will just say that they are pretty much right along with what we just had for the ADN. I don't know if I need to read all those again because I believe that we just used exactly the ones that we had in terms of strength. The whole program, the way it's set up, does support both levels very, very well. The opportunities identified, again, the systematic evaluation plan, same issue with the student learning outcomes, very well defined. The rest of it could use an opportunity to expand that into other program areas. Licensure denials, KSA 651120, again, for the PN level, also to make that connection with that statute and make that language a little bit stronger. Library processes, again, to make sure that they're no more than 5 years old. And then the process to ensure all required information in faculty files, mostly due to that orientation piece. Recommendations for the PN, the language on KSA 651120 added to documentation that's available prior to admission that clearly refers to the statute, and to submit that by March 31st of 22. One other thing, contracts all need to include language that state the clinical facility retains responsibility for patient care. They had one contract that was out of compliance with that language, and to get that revised to address that deficiency, and send that new contract language to Ksbn by March 31st. Update the systematic evaluation plan to include all program areas with goals, dates, data, actions, and review, and submit that by June 30th, 22. We recommend reapproval of the PN program for a period of 5 years.
Okay, Chelsea, I guess we're ready for a motion.
Is there a committee member who would like to make the following motion? I move to accept the site visit report with recommendations for Kansas City, Kansas Community College PN program, reapproving the PN program for a time period of 5 years.
Do I have a motion,
This is Christina. I'll make that motion.
Christina, and a second?
This is Michelle Berdashai, second.
Thank you, Michelle. Second discussion. All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Thank you for that, Janelle. We'll move right on. Washburn.
Okay, we did a site visit for the PN program at Washburn Institute of Technology. I did that visit on September 29th and 30th in conjunction with Dr. Karen Kidder. Let's see, strengths identified for the program. There's very strong support for the nursing program from the Washburn Institute of Technology and the Washburn University administration, of which they're a part of as well. The Health Occupations Director, Pam Masters, has strong support for the PN program and has made very strong improvements to faculty minutes and led creation of a formal program evaluation plan that had not been present before. Students very complimentary of the clinical sites and of the faculty support. A great facility with large lecture areas, their low fidelity labs, and exceptional regional simulation center that they also share with Washburn University. And I think with the local hospitals also may have some work there as well. The advisory committee identified instructors as a huge benefit to the students in the program. And they were also very complimentary of the open two-way conversation between clinical sites and instructors. Students like the small class size, instructors are very approachable and say the faculty really care about our well-being and future, and they would highly recommend the program. Some opportunities for improvement. Said to continue a process of follow through on faculty and advisory board minutes, very well documented, but the follow through was not always as clear. Create administrative bylaws to define the structure and process of the PN program. Great start on the program evaluation plan. Continue with collecting that data and using information for ongoing improvement. Consider adding end of program learning outcomes to the current plan. Review % of clinical observation in each course to ensure that time is 15% or less of their clinical hours. They had one that was just slightly over. Develop a written plan detailing testing process and analysis. Develop a process to ensure all Ksbn required documentation is present in faculty files. We just had a couple that were not quite all there. Opportunity to refine the process to ensure follow-up with student who is on probation with an improvement plan. There was some documentation for students, but not as well documented or documented that the student had like a written signature that they had seen the plan. Consider hiring a clinical coordinator to arrange clinical times paperwork and attending clinical utilization meetings that happen for the Topeka area, thus relieving burden from faculty. Faculty spend a lot of time in trying to coordinate clinicals and when changes are happening, and it takes quite a bit of extra time for them, and they don't have someone really looking at the whole process, except for Pam, who also does all of health occupations as well. So the recommendations for the program, again, based on regulation, create faculty bylaws for the nursing program and submit those to the Ksbn by March 31st of 22. Reduce observation percentage for PNS 226 to less than 15% of clinical time. Submit revised clinical schedule by March 31st of 22. Develop a written testing policy for test development, process, and analysis. Faculty were able to verbalize there just is not a written process for them. And submit to Ksbn by March 31st of 22. And then we recommend reapproval of the program for 5 years.
Thanks for that, Janelle. Chelsea, do you have another motion?
Is there a committee member who would like to make the following motion? I move to accept the site visit report with recommendations for Washburn Institute of Technology PN program and reapproving the PN program for a time period of 5 years.
Do I have a motion?
This is Michelle Burdishaw. I motion.
Thank you, Michelle. And a second?
This is Juliana Reshik, and I'll second.
Thank you, Juliana. A motion, second, any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries. The next one I have on the list is Heston College BSN program.
Yes. Heston College, we did their, this was one of our virtual visits, and we did this in conjunction with CCNE on October 6th through the 8th. Dr. Amy Height was the second reviewer for Ksbn. Let's see, sorry. Strengths for the program, they had a very, very organized, informative virtual resource room. It was very well put together and easy to find information. The self-study was very useful, and they did one for Ksbn as well as CCNE. And all the it was very conducive to finding the necessary documentation, made it very easy for us. Students were very vocal. They love the Heston College community. They feel very supported in that nursing program, very complimentary of the faculty and faculty support about the personal connections and their caring. They provide clinical experiences that really help them translate theory into practice. I thought that was an interesting statement by one of the students, well, more than one of the students. Their help with financial aid is good for the nursing program. They have a lot of financial support and scholarships, and students feel very nurtured and supported by the faculty. Their student support services are very well documented, and students speak to the availability and knowledge of those services. Faculty evaluation and review process is very clear. Faculty find it a helpful process for their own development. The academic dean has taken the opportunity to visit each faculty classroom in her first 2 months at Heston College, which is a little unusual, I think, but she speaks very knowledgeably after only 2 months there and very supportive of that program. They added a telehealth option for mental health this year for students. This is for students being able to access mental health services. And they added that option and said that that had been well received, and many students had said that they knew about it and some had used it. The relationship of the school with the NMHC healthcare there in Newton, the students like the site. They feel like they learn a lot, and the staff is very complimentary of the students and the faculty. There's great collaboration between their liberal arts faculty and the nursing faculty. We had about 10 of their general education and liberal arts faculty that attended that meeting and spoke very highly of the nursing faculty and the engagement they have with them. The advisory board and clinical agencies appreciate the engagement with the faculty. They recognize the special attention and support that that the faculty provides the students, and support the administration and faculty provided through COVID. They said they had very good communication and were well supported during that process. Administration supports faculty with development opportunities, financial support, and encouragement to grow. Many faculty continue to practice as RNs. This was a little bit more, we saw this with several of the faculty, and it helps the faculty keep current with industry, and their 9-month contract allowed them for some additional income that way. Opportunities for improvement. One of the things, even though they're well supported in many ways, there is an opportunity to do more for faculty salary. CCNE also noted it's a little bit low, but there's so many other benefits that they be able to provide that. But many of them do also work during the off time. Might look for partnerships with industry to support faculty. We talked to donors about the need for qualified, adequately compensated faculty to keep their quality in their program going. They have a lot of good nursing scholarship support for students, but not so much for faculty. Clinical agencies would appreciate increased numbers of students and will accommodate clinical opportunities, employ additional graduates. The possibility for academic practice partnerships was raised as well. One thing, clarification of KSA 651120 and possible licensure denial and program materials. It needs to be available in the program information. Admission policy refers to the legal standards, but did not specifically reference the connection of KSA 651120 to licensure denial and issues there. And the link, they have no link to the statute or any specific reference to that. Okay, so in conclusion, for recommendations to review contract language for cited, there was one contract that did not address the facility responsibility for patient care and for staffing independently of student assignments, and to submit a copy of that prior to March 31st. And I will make a note here that that has already been done. The contract has already been revised, and I have that update in the office already. They've already taken care of that. The only other thing we had then, I guess I apologize. I should have added the recommendation to clarify the KSA 651120 information. Should also be a recommendation just to make sure that that's clear and clearly referenced in prior to admission. And then we recommend reapproval of the program for the time period of national accreditation.
Thanks, Janelle. And I think we have another motion.
Is there a committee member who would like to make the following motion? I move to accept the site visit report for Heston College BSN program and reapproving the BSN program for a time period of national accreditation.
Madam Chair, I had a quick, if you could offer me some clarification, do we need to make an amendment to the site visit report before we make that motion?
I believe we do.
So, Janelle,
I think that recommendation, there needs to be that second recommendation on the KSA 651120 language.
so we need to add that to the motion.
Need to add that to the motion for that recommendation to be added.
So tell Chelsea exactly what you want her to add to that motion.
The recommendation number 3 should be to clarify KSA 651120 possible licensure denial information in pre-admission material.
Okay, Janelle, clarifying KSA, what was the statute?
651120.
And then tell me one more time the language that we're clarifying in it to.
To clarify the possible licensure denial in program materials available prior to admission.
Okay. Is there a committee member who would like to make the following motion? I move to accept the site visit report for Heston College BSN program, clarifying KSA 65-11-20 for possible licensure denial in program materials available prior to admission, and reapproving the BSN program for a time period of national accreditation.
This is Christina. I'll make that motion.
A motion and do I have a second?
This is Dee, and I will second that motion.
Thank you, Dee. So motion is second. Any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Christina, thanks for helping out with the motion there. Okay, we'll move to the next one, which is Cobb County Community College, Geary County Satellite Campus ADN.
Yes, we did on October 14th, Christina Rudisell and I did a site visit, just a one-day site visit to their, we had done a major curriculum change, or they had done a major curriculum change, asking to add that satellite campus for their ADN program using the same curriculum. They do have a couple of faculty additions, but to provide that at their Geary County campus in Junction City. It was a very, very well done site visit. The strengths for this addition, there's very, very strong community support for adding a nursing program at the Geary County campus. Nursing is identified as a critical need for the community by the Geary County Commission. They've been working with local commission and to get that support and get that program up and running there. The strong support and commitment from the Cloud County administration for this program and to provide that support for both campuses. Strong leadership and organizational skills from the current nursing program administrator, Stephanie Perrette, did a wonderful job in organizing this site visit and the people that were there to speak to the addition there. Prospective students are very supportive of the program and very familiar with the program and the current outcomes. Positive feedback from the students about the reputation of the program and support from the Cloud County faculty and the nursing staff. They get all their information and feel like it's all very clear and they know what they need to do. Faculty involvement in the process, they've been very involved in the planning, and most will support the program at the Geary County campus with teaching in the first year. There will be some additional changes to that. Some will be driving back and forth and doing both campuses, but there are some also dedicated just to the Geary County campus as well. The Geary County campus will be one semester off from the Concordia campus, so they'll be teaching different semesters, different times. So that helps with the faculty and not having that overlap. And it's a little bit more accelerated program for the Geary County students using the same curriculum. Adjuncts were also very involved in the nursing program. They have input into the program and are given opportunities to contribute. They work very strongly with the adjuncts as well as full-time faculty. The Geary campus serves a very non-traditional group of students and with many opportunities in the evening as well as daytime, and that's been a great advantage for them. Opportunities, just to clarify the language in faculty contracts to prioritize MSN as the required degree for faculty, with the BSN degree plan as an alternative option, but need to make it clear that the MSN is what the regulation requires. Hire qualified faculty as needed and continued strong communication with their communities of interest. Recommendation is approval of the satellite campus for Cloud County Community College Nursing Program with the admission of 18 students for spring of 2022 and annually thereafter, with a follow-up visit for the site campus to occur with the next planned visit for Cloud County Community College as a whole in the spring of 2027, sorry.
Thank you, Janelle. Do we have another motion?
Is there a committee member who would like to make the following motion? I move to accept the site visit report for the satellite campus at Geary County for Cloud County Community College ADN program and to approve the addition of the nursing program at the satellite campus with the addition of 18 students for spring 2022 and annually thereafter. A follow-up visit for satellite campus to occur in conjunction with the next reapproval visit for the current Cloud County Community College nursing program in spring 2027.
Do I have a motion?
This is Andrea Watson. I'll make the motion.
Thank you, Andrea. Do I have a second?
This is Christina. I'll second.
Thank you. Any discussion? Hearing none, all in favor say yes.
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 Opposed say no. Any abstentions? That motion carried. Hello, Michelle. I see you're back with us. Glad you're safe and sound.
Yes, thank you.
So, Chelsea, take a switch here. Is that okay? We'll let her go ahead and read the motions from here. Is that what you want to do?
Yep, that sounds great.
Okay, so we'll move to the next one then, Janelle, and that's Seward County College Bi-Level ADN program.
Okay. Thank you, Madam Chair. Seward County, we did a visit for their ADN, their level 2 program, and we did this in conjunction with ASIN as well on October 20th through the 22nd. Rebecca Sander, a board member, was the second Ksbn site visitor. Strengths we identified for the program: there's a very strong community support for the program, their clinical sites and employment of program graduates after graduation, strong reputation of the program with the students and the community and clinical agencies, very dedicated faculty committed to student goals and success. They show tremendous teamwork and student support, creativity, communication, engagement, and commitment. They have a new allied health nursing building on the main campus. They had been off-site prior to that new building. I think it opened January of 2020. They had some delay because of COVID, but it's open and they had their grand opening in a very nice facility. Updated simulation facilities with a new full-time simulation faculty for the program. Simulation is incorporated throughout the curriculum. There's good administrative support for the nursing program, the nursing director leadership and vision for the program, and the new updated and leveled curriculum for both levels of the nursing program, which was very well done and has been in process for them. Opportunities: the format of the faculty minutes did not clearly reflect responsibility for follow-up items. It'd be helpful to have a better idea of that. Student attendance at faculty meetings and documentation of that attendance, opportunity to clarify the expectations for the student reps and their involvement and attendance at faculty meetings. Explore opportunities beyond ATI for assessing student learning outcomes. Right now, most of those outcomes are based on ATI assessments. Preceptor documents to ensure all the language on the preceptor documents uses the language of feedback and not evaluation when completing student documentation. Make sure the evaluation lies with the faculty. Make sure all clinical contracts contain language required by Ksbn. Again, one contract, I think we had an issue with not having some of the required language. Continue to monitor NCLEX pass rates and update the improvement plan as needed to raise first-time pass rates above the regulatory standard, which leads to recommendations. One is to review and revise the preceptor documents to ensure faculty is evaluating the student and preceptors and providing feedback and input to the evaluation. To submit those revised documents to Ksbn by March 31st. And I will make a note here that that has already been received by our office. Their updated information has already been received and revised. To review the one contract and add appropriate language regarding patient care responsibility and staffing, and to send an update of that to the compliance officer by March 31st. I do know that is in process as well. That was sent along with, they've sent a revised copy. It has not been signed yet, but it has been sent in. Continue to monitor NCLEX pass rates and update an improvement plan as needed to raise first-time test taker pass rates consistently above regulatory standard, and continue with 6-month update reports on the pass rate improvement plan, with the next report due June 30th. Annual reports will be reviewed by Ksbn in March of 2022. And make an additional statement there, a clarifying statement that they will also continue on conditional approval. They were put on conditional approval, and that statement needed to be in number 3. So that is an amendment to what you have there, is that it will remain on conditional approval. And then the final recommendation is recommend reapproval on conditional status for the ADN program for the time period of national accreditation.
Thanks, Janelle. Do we need to amend the motion that Michelle's getting ready for?
Yes, I believe Michelle will have an amended motion that there is an additional, I didn't have it on mine. I should have put it on my note. The motion should have the additional recommendation that they will continue on a conditional approval status.
Okay, Michelle, then we'll let you go ahead and read that motion if you would.
Okay. Is there a committee member that would like to make the following motion? I move to accept the site visit report for Seward County Community College bi-level ADN program with an additional recommendation to clarify the program remains on conditional approval and grant continuing conditional approval for the ADN program with next site visit to occur with national accreditation.
Do I have a motion?
Madam Chair,
This
this
is
is
Amy.
Dee. Oh, go ahead, Amy.
Sorry, Dee.
Go ahead.
Madam Chair, this is Amy Hyde. I'll make the motion.
And then I'll second that.
Thank you, Dee. Motion is second. Any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? Motion carries. One more on the site. Thank you. One more on the site visit reports. And
No more site visits, no more site visit reports. That was the last one.
have a clarification for Fort Scott, correct? That we added there.
Yes. So what I needed to do is clarify in the September meeting when the programs were put up for reapproval, Fort Scott was included in the ADN program or in the motion for reapproval of those on conditional approval status. And Fort Scott is not. And I apologize for not catching that when we made the motions, but they should have been with the group that was approved for the fully approved group of ADN programs and not on the conditional approval. So I do have a motion that I gave to, that Michelle has, to just make a motion to clarify that and that they will remain on, they should be fully approved from July 1st through December 31st, July 1st of this year of 2021 through 31st of 2022 on full approval status and not conditional.
From from July to December or July?
Well, when we do the reapprovals in September, it goes from July 1st of the current year through, just because we do those approvals. We usually do that in September, but it does cover that extension through the end of the year. So it goes from July 1st of 2021 through December 31st of 2022.
Or 22, okay. Okay, we have a motion. Thanks for the clarification. Do I have a motion on the floor?
Is there a committee member that would like to make the following motion? I move to approve the correction to the annual reapprovals for the nursing programs done at the September board meeting to include Fort Scott Community College under the fully approved ADN programs and not under the conditional approval programs.
This is
Madam Chair,
Christina.
this is Amy Height. I'll make the motion.
Thank you, Amy. Christina, you want to
Christina, I'll
that?
second. Mhm.
Thank you, Christina. Motion and second, any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? Okay, that motion carries. So that concludes all the site visit work that we had.
Yes.
Okay, I'm going to go ahead and move on to new business with initial applications for new nursing programs. And the first one we have on the list is Mid-American Nursing and Allied Health Institute PN program.
Yes, and Colton, we will need to move Susan Amare and Susan Watson. I'm not sure if I think they're on the same Zoom, but they will be doing the presentation for their application for a PN program.
I just moved them.
Okay, we'll get them up here and let them do. And I asked all the three that have the new programs to hold their remarks and to about 5 minutes, if possible. There they are.
I see two Susans there. So some presentation for us this morning.
Susan, if you could go ahead and
there you go.
Can you hear us?
there you go.
Yeah, we can hear you now. Okay, go ahead. We'll let you do the
Thank you
presentation.
for your time to review the proposal that we sent in October, and for this time also to be able to spend a few minutes with you to share our program and to invite you to our site to see what we have in terms of space and in terms of lab for the LPN program. So Susan Watson and I will basically spend the next few minutes to highlight the need for additional nursing school in Kansas. Mid-American Nursing has been in business for 5 years, and we have contributed immensely to the community by producing or training, CNAs, CMAs, and phlebotomists, many of whom are also within the community. I will hand over to Susan Watson to talk about the shortage of nurses across the nation, really.
Yeah, so thank you. Thank you for having us. One of the ways I approached this was I contacted some of the local colleges, and they have LPN programs, and I wanted to see the waiting list that they had. That's one of our problems is, because of the waiting list, they'll go to other states to go and get into LPN programs. If we have more LPN programs, we can keep them within our area. So the nurses are leaving the profession for other professions due to it, the burnout, especially with COVID right now. 66% of the nurses say pandemic has made them consider leaving the profession. So also the shortage, aging, aging is a big problem there. And however, we are losing our seasoned nurses and nursing instructors. That's always been a problem there too. Hopefully we can bring on board new instructors and get them trained. A couple of the colleges that I checked with, there was a long waiting list to get into one of them, JCC. I'm getting used to your colleges around here. They had mentioned that they had 250 qualified applicants for 80 seats. So that was, you know, kind of a stark realization there.
So basically, we have been unofficially partnered with JCC, especially for our CNA program. They have been very supportive of us in terms of referring students that are not able to join their programs. So we are ready to partner with, you know, schools in the area to reduce the shortage that we currently have in healthcare. You know, nursing homes are struggling. You know, they don't have nurses on staff. So we look to tap into that pool to be able to not just keep these people in the state of Kansas, but also to add more to the nursing pool so that healthcare will not be at risk. Because right now the crisis is so much that, you know, the future of healthcare is at risk, and also the future of patient care.
Ma'am,
yeah.
I wanted to mention I moved here from New England. So back east, I was the director of an LPN program for 8 years. What I saw was our facilities in our surrounding area needed nurses. And by having our LPN program, we were able to supply them. What happened is Vermont was right across the border, like how you got Missouri here right across from Kansas. But yeah, our students that graduated stayed within our state. Very few went over the line because their families are there. We've given them the opportunity of a program. We want to offer it during the day, during the evening. I mean, gradually to build to that, and even on weekends for the working family. And we want to keep that revenue within Kansas and help staff these facilities all around us. And we always have a good relationship. Mrs. Omari, who haven't had the program for 5 years, has a very good relationship with the facilities in the area. So we can, you know, expand on that.
So basically, we're looking to join, you know, other schools in the community to help, you know, build the numbers for nurses. You know, that way we can ensure that healthcare is not going to be greatly impacted as it is right now. You know, in 2020, we were the very few schools we were open during COVID-19. We had clinical sites that were open for us, and we were able to release 310 certified CNAs, you know, in 2020. That COVID-19 did not stop us from, you know, fully going into the clinical site. So having an LPN program is something we are looking to, you know, tap into, and also to help the communities, you know, with more nurses. We have 5 years of, you know, experience, and we have, you know, great reviews, not just from the students that have finished from our school, but also the nursing communities and also hospitals. Hospitals usually do not hire LPNs, but now they're looking for LPN students, LPN nurses. You know, our proposal will be able to fill the gap and make an impact in the community. Mid-American Nursing is 100% woman-owned, and if I may add also minority ×2. So we look to your consideration to give us the opportunity to be able to continue to serve the community as we have been in the past 5 years, and also to partner with schools. Again, JCC has been very, you know, supportive, you know, indirectly, you know, by referring students to our school. Thank you.
Thanks for that introduction. Janelle, the process here is this is initial applications for the nursing program. Can you describe where we're going from here and what that means with our motions that we handled today?
Right. So this is Janelle Martin, Education Compliance Officer. We're looking here, this is their initial application and everything that they've submitted is for their looking to see whether they have enough information here to ask you all for us to make a site visit to look at the entire program before they admit students. So the process here would be to approve them for a site visit if you feel like everything in the initial application would lead you to say that that would be the next step.
Okay,
They
thank
have to do the site visit before they could be approved to admit. And I believe, and Susan, you can correct me if I'm wrong, but I believe they're asking for admission to start in August of 2022 for their first cohort.
Yes, ma'am.
Susan, would you just highlight for us the amount of students you're talking about for this initial application?
So we're looking at 60 students because we have 3 schedules. We have the day schedule, we have the evening schedule, and the weekend schedule. Given the approval, we think we are able to manage, those students, in the first year. It's not just having a student, but just making sure that they are also very successful. We have been very instrumental in ensuring that our current students are well placed. So having 60 students in the beginning is something we're looking to, given your approval.
Okay, thank you for that. Any questions for the group here that's given the presentation from Mid-America?
This is Michelle Berdishaw. I do have a question. And it's, as I was looking through the documentation for support of clinical sites, are the LPNs, the PNs going to be required to be in the hospital setting? And would that be that you're placing 60 students within a semester time frame? And currently we have challenges getting our BSN students in Kansas City into placements. So how would you navigate this, or what are your plans to do that if they are indeed supposed to be in the hospital setting?
Yeah, so with regards to hospitals, some of them do not hire LPNs at this time, but we have an agreement with Advent Hospital at this point for their physician offices to be able to have LPN students. Not necessarily all the 60 of them, they will be spread out in the community. We have nursing homes, that need LPN. So we have multiple clinical sites, including hospitals that will be able to assist with the clinical rotation.
So they're not required to be in the hospital setting?
Yes, especially, well, that might change because my conversation with Advent Health, for example, is that they might be open to having LPNs in the hospital, especially with the impact of COVID-19.
So,
okay.
Nancy, something with some, I know it's difficult to have, the PNs in the hospital setting. Hopefully we can with Advent, but Advent also has other areas that they would be able to go to, say dialysis or I don't know, wound clinic, they also have a long-term care facility, attached with them. So as far as the acute care, rehabs and a lot of the long-term care, we're able to pick up a lot of that acute care in that environment if we're unable to get them into a hospital. But, one of our goals is that I think any of our nursing programs is like that. So we would try to aim towards it.
From my conversation with some of the hospitals, especially Advent Hospital, again, given the impact of COVID, they're looking for anybody, so they're ready to bring in, LPNs, and LPNs can handle whatever care that's needed in the hospital to a great extent.
Thank you for that clarification. Any other questions for the group here?
Thank you.
Madam Chair, this is Dee, and I have a question about, is this a single entry in August or is this a double entry?
It will be a single entry. So we'll have 3 flexible schedules and we will only run it for 1 year. Thank you.
Any other questions for the group? Christina, I see you have your mic off.
Yeah, I have a few questions. Christina Rudisil. And so one of my questions is where, I know that there's a lot of long-term care centers in Kansas City Metro, but I didn't see any. I saw like 2 in your packet that looked like they maybe agree to that. But have you talked to other facilities of where you do clinicals? Because that's going to be your primary source for PN.
Yes, we have added more clinical sites since the application was sent in October, and we are continuing to add more. By the time you're here for your site visit, we'll have a boatload of more sites, to show you.
Okay. And then also, I think, and correct me if I'm wrong, Madam Chair or anybody else, but do we need to see the signed contracts upon an application, or is that upon site visit? I'm confused.
Yeah.
Site visit.
This approval they're looking for today is for an initial application that we can do a site visit, and that's where some of the clarification will come. Then it will come back to us with that information and that review of their documents and their sites, et cetera, et cetera. And then we'll have another chance to go ahead and approve the program or not, or whatever we decide to do.
Thank you for that clarity. I haven't done this one before, so I wasn't sure how that worked. So, okay, thank you.
Anything else? Okay. Any other questions that we have here? Okay, then I guess we're ready for another motion.
Is there a committee member that would like to make the following motion? I move to accept the initial nursing program application for Mid-America Nursing Allied Health Institute with a request to offer a PN program with a site visit to occur before approval is given to admit students.
Do I have a motion?
This is Juliana Reshik, and I'll make that motion.
Motion, do I have a
This
second?
is Amy Hyde. I can second.
Thank you, Amy. We have a motion and a second. Any other discussion? Then all in favor say yes.
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 All opposed say no. Any abstentions? That motion carries. Thank you for your input today.
Thank you so much for your time. We look forward to seeing you.
Thank you. I'll be in touch.
Thank you.
So the next step we'll have here will be that Janelle is going to set up a site visit date, and then she will be asking some committee members to help her with that visit, whoever that might be. So if you're interested in doing some of that, or if it's your first visit, talk to Janelle. She'll have some opportunities for you. I know the first one I did many years ago, I did the compliance officer at the time and another committee member were doing that, and I volunteered to be the third person just so I could learn how that worked and how we did that. I wasn't the second person, but the third. And we can make that happen for you because that's kind of a comfort zone to be able to start before you're really the one that's looking at the documents and making some of those things on paper for this committee, because that's the eyes and ears of the review for this committee. And this is important stuff. So when you see that report come across, you need to, I'm preaching to the choir here, this is the perfect group, but really look at that, because when we get to the committee meeting, you can see how I move pretty quickly through that. So you don't have much time to review. It has to be done before. So I appreciate your help there. So if you're interested in doing that, let Janelle know. Janelle's going to owe me for putting in that plug for that kind of
Yes, thank you.
Okay, let's move to the next one, Wsu Tech Adn Program.
Yes, and Colton, I believe Pat Plank is who I think we're looking for. I think Lynn Loveland and Sarah. Oh, I sent you the names. I apologize. Can't think of Sarah's name off the top of my head, but I think we had those three. Sarah Leftwich. I'm sorry, Sarah. I apologize.
Pat, there you go. I see you there.
I think I found them all.
Okay, thank you.
Hey, Pat, are you going to do the presentation this morning for us?
Yes, I will.
Thank you very much. Go ahead.
Okay. I don't really have a whole lot to add besides what's in the report. Basically just a little bit of history. We have discussed trying to offer an ADN program in Wichita for many years. And when we first started talking about it, there were 2 proprietary schools that have since closed that were offering RN programs in addition to the 2 BSN programs and then the surrounding areas. At that time, the nursing shortage was certainly not what it is now. And so we felt like that that was not the time to do it. About 2 years ago, our president convened a group of healthcare leaders in the community, including representatives from Ascension Via Christi, and I believe Juliana was at that meeting, and other representatives. And one of the discussions was, we're looking at a shortage of RNs. Well, since then, we've had COVID, and that has exacerbated that situation. And actually both health systems here, both large health systems here in Wichita, Wesley and Ascension, are starting to increase their utilization of LPNs to help address the nursing shortage. And so we decided that this would be the right time to look at beginning that program. So we actually started work on it about 2 years ago. And of course, it got slowed down a little bit with COVID, but we have worked on the curriculum and feel like we're ready to move forward with it now. So what questions do you have for me?
So this is an ADN program?
Yes.
Okay. Any other questions that we have for Pat? Once again, this is initial application for a site visit to check that documentation and that work before we would approve the program to admit students.
And Pat, would you clarify number of admissions you're wanting to admit?
We're wanting to admit 20 students and hopefully fall of 22.
Okay.
That's our goal.
Any other questions? Then Michelle, I guess we're ready for a motion.
Is there a committee member that would like to make the following motion? I move to accept the request from Wsu Tech to offer an ADN program to the current location with a site visit to occur before approval is given to admit students.
Madam Chair, this is Dee Bonenblust, and I will make that motion to approve so that we can do the site visit for Wichita Area Tech.
Thank you, Dee. A second?
This is Christina. I will second that.
Motion is second. Any other discussion? All in favor say yes.
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 Opposed, say no. Any abstention? That motion carries. Thanks for your time, Pat. And Sarah.
Thank you.
Okay, we'll move to the next one then. North Central Kansas Tech Beloit ADN program.
And Colton, I think we're looking for Melissa Crump.
They're loading in.
Thank you, Colton. Colton makes this job a lot easier. I tell you, he sure made the life easy through this Zoom work we've done for the last, I don't know how many months. There's Melissa. Welcome.
Can you hear us okay?
We can. Would you like to present your work for your new nursing program you're looking at?
There. Yeah, sorry, we're adjusting our camera so you can actually kind of see most of us here. So thank you for the time to let us speak about what we're wanting. I'm Melissa Crump. I'm the director. I also have Jen Brown, who's our Dean of Instruction, and we also have Sarah Arnold and Sam Miller, who are nursing faculty here. So we currently have a practical nursing program established, and we feel like we've been pretty successful with that. So our request is to convert our standalone PN program to a 1+1 program. We are wanting to pretty much adopt and pull over what our Hayes campus is currently doing. They have a 1+1 over there with an established curriculum, and we are adopting that or requesting to adopt that over here, along with the admission process. So our total credit hours would just be 70. We have the space, we have the equipment, we have the laboratory setting to accommodate a second year. And so we feel like we would love the challenge of beginning that. We are also putting a voluntary hold on our first year to only 25 so that we can focus on the requested second year and make sure that we've got things rolling well. Our students, both past and present, have really been vocal to us about wanting a ADN year with us. And so it's been something that we've been talking about for a long time, and we started working on a couple years ago. And so kind of, as Pat was talking, it's kind of funny because kind of the same scenario there, but we felt like now would be a good time. We are also requesting to start in August of 22 with 15 students. Our community is also a great support for us. Our advising meetings are always mentioning, when can we make this happen? They really want the second year, the ADN level within our college as well. We have a great team right now, great administration. We feel like now would be a great time to get this established. You guys have any questions for us?
So here 15 students, and then would that be your max you would probably take, or was there work to advance that?
We'd like to start with 15 for our second year to start with, and then gradually increase. Now, we put kind of an example on our application, knowing that that wouldn't necessarily be something we would be able to approve out the gate, but just so you guys could see the gradual increase that we would be anticipating, and then we would obviously take the appropriate steps to request that with the board as needed.
That's 326 of your packet, just in case you needed to find that.
Thanks for that clarification.
Mm-hmm.
Any other questions for the group? Okay, hearing none, I guess we're ready for a motion. Michelle?
Is there a committee member that would like to make the following motion? I move to accept the request from North Central Kansas Tech Beloit to offer an ADN program at their current location with a site visit to occur before approval is given to admit students.
This is Michelle Burdishaw. I approve.
Thank you for that motion. Do I have a second?
This is Andrea Watson. I'll second.
Motion is second. Any other discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Thank you, Melissa and group.
Thank you. Thank you.
Did that help? The next is major curriculum change requests, but if it's okay with the group, I think we could take a 10-minute break and reconvene in 10 minutes. Would that be fine?
Yes.
So it looks like that would be, let's just say 10 after. So 10 after 10. I'll see you back in a few minutes. Thank you. Okay, it's 10 after 10. Colton, are we ready to go again?
Yep.
Okay, thank you for that. Before we get started again, I just want to thank everybody for taking time out today to do this. I know we all have a long list that's 2 or 3 pages long we could be doing, but I appreciate your help with this and your work before you get to this meeting. This committee is busy, and any of you that are here can contest to that with the packets that we get and that we are asked to review before we come to this meeting. So I appreciate that effort. And I know everyone watching, which I see now on my screen, there's 40 participants watching this. When we've met in Topeka, that room was pretty full. So, and interested in what we're doing. So we owe it to that group to make sure we are making decisions in the best interest of all. So I thank you for your help. Let's go on to major curriculum change request. And Janelle, I think we're going to start with Washburn University BSN program.
Yes, and Colton, I believe Jane Carpenter is available to give us a summary of that request.
It should be on their way.
Okay, thank you.
Hello, can you all hear me now?
You can.
Thank you. Our request is to move our NU 318 professional transformation course from a face-to-face to an online format. As many of you had to do during the pandemic, we moved this class online, and we actually found that the student feedback for this course was really positive. Students had better for reflection when they had a little bit more time to think about what they're learning. So what we would like to do is to continue this in an online format. We're not planning to change any course outcomes or course description at this time, just the format of the course. So
just delivery method. Any questions for Jane? Okay, then Michelle, I guess we're ready for motion.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Washburn University BSN program to change delivery method for course NU 318 Professional Transformation from in-person to online.
This is Juliana Reshik, and I'll make that motion.
Okay, and this is Dee, and I will second that motion.
Thank you. Motion is second. Any other discussion? All in favor say yes.
Yes.
Yes. All opposed say no. Any abstentions? That motion carries. Thanks, Jane.
thank you very much.
Okay, we'll just keep moving right down the list to Baker University BSN program.
And Colton, that will be Dr. Libby Rosen.
They were doctor, so D, not L.
That's why I said that, Colton. I should have clarified.
No, that was my bad. No big deal.
Thank you.
Thank you.
Welcome. We'll let you go ahead and talk about your curriculum change request that you have for us today.
Okay, the curriculum change that we have is our NU 323 LPN Bridge course. We would like to change that from 3.5 credit hours to a 4.0 credit hour. We're adding in population health, consideration of aging clients, as well as diagnostic testings. And this half credit also would then allow the LPN students to be able to be into the financial aid amount of 12 hours. I've been listening to so many interesting ADN transition courses that I got my alphabet mixed up.
So a change with your credit hour delivery that you have. Any questions that we have for Libby? Okay, hearing none. Do I have a motion, Michelle?
Yeah. Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Baker University Ksbn program to change the credit hours for NU 323 LPN bridge course from 3.5 to 4.0 credit hours.
Madam Chair, this is Amy Hyde. I'll make the motion.
Thank you for that, Amy. A second?
This is Michelle Burdishaw, second.
Thank you, Michelle. Motion is second. Any other discussion? All in favor say yes.
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 Opposed say no. Opposed say no. Any abstentions? That motion carries. Dr. Rosen, I'm glad you approve of this change. That's good. Okay. Thanks for that. Okay, for your time today. The next one we have here is Butler Community College ADN Program.
And Caleb Ediger will be presenting that change.
Good morning, everyone.
We're going to let you talk about your major curriculum change request.
Yes. So over the summer, we were approached by Cali College to expand into their Winfield Allied Health campus to take over the vacated area that Pratt left there with their ADN program. And so what we're requesting is to add 8 additional seats to our program to be taught at the Winfield Allied Health campus virtually from our campus. And that would be on a once-a-year admission cycle is what we do. All of their clinicals will be done in Sumner and Cali, and we would focus on trying to close the gap since they have no real nursing programs in that area anymore. So to kind of, send nurses back into those hospitals, William Newton, and then South Central Kansas Regional Medical Center down there.
Thanks for that. Any questions for Caleb? Hearing none, Michelle, I'll let you read us a motion.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Butler Community College to add an additional 16 nursing seats, 8 each academic year, in partnership with Colley County Community College. The additional 8 students per academic year would be from Colley County Community College and would be taught by Butler Community College nursing faculty at Colley Community College Allied Health Campus in Winfield.
Do we have a motion?
Madam President, this is Dee, and I will make that motion.
Second.
This is Andrea Watson. I'll second.
Thank you, Andrea. Motion is second. Any other discussion? All in favor say yes.
Yes.
Yes. Opposed say no. Any abstention? That motion carries. Thank you, Caleb.
Thank you.
We'll move to the next one, Emporia State University BSN program.
Thank you, Colton. Mary Mitsui is presenting for Emporia.
There's Mary. Welcome.
Hello, thank you. Emporia State University is requiring 6 changes to our BSN curriculum. The total credit hours for the degree will not change. There'll still be 60 credit hours in the pre-nursing courses and 60 credit hours for the nursing courses. Our first change is to eliminate CW 152, Intro to Health Careers. And our rationale for this is that ESU will be implementing a new general education program in the fall of 2022, and CW 152, which is currently a general education course, will no longer fit the criteria for a general education course. The pre-nursing students will be able to choose from a variety of other courses to fulfill the general education category that CW 152 currently fulfills. The second change is to decrease NU 311 Fundamentals Nursing Practicum from 3 to 2 credit hours. In our most recent curriculum revision, we had increased this course to the 3 credit hours. However, adding the credit hour made the clinical day longer. It did not increase the number of days that the students were in the clinical setting. And as our clinical hours are 4 o'clock hours for each credit hour, the faculty believe that 8 clock hours of clinical per day is sufficient to meet the course objectives. The third one is to increase the NU 382 geriatric nursing from 1 to 2 credit hours. And the faculty believe there's a need for the increased content in NU 382 to help prepare our graduates to take care of the aging population. The fourth one is to eliminate NU 379, Decision-Making in Nursing 1. When NU 379 was created, the nursing program was 6 semesters long. This course was originally in semester 4, but our nursing curriculum recently changed to 4 semesters, and this course is now in semester 2. And the faculty believe the students don't have enough content and knowledge in semester 2 for this course to be effective. The fifth change is to increase NU 392 end-of-life care from 1 to 2 credit hours. The faculty believe there is a need for increased content in this course to help prepare graduates to deal with issues related to death and dying. And the sixth change is to decrease NU 429, maternal, newborn, and pediatric nursing practicum from 3 to 2 credit hours. Students who are enrolled in this course are also enrolled in another practicum course during this semester, in which they can also care for children and their families. And those are our changes, our proposed changes.
Any questions from the group from Mary? Hearing none. Motion, Michelle?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Emporia State University BSN program to change the following courses in the curriculum. Eliminate CW 152 Intro to Health Careers course. Decrease NU 311 Fundamentals Nursing Practicum from 3 to 2 credits. Increase NU 382 Geriatric Nursing from 1 to 2 credit hours. Eliminate NU 379 Decision Making in Nursing 1 1 credit hour, and add this credit to NU 431 Decision Making in Nursing 2, 1 credit hour, to make one course of 2 credit hours. Title change requested per minor curriculum change for NU 431 to be just decision making in nursing. Increase NU 392 end of life care from 1 to 2 credit hours. Decrease NU 429 maternal newborn nursing practicum from 3 credit hours to 2 credit hours. The changes will not change overall credit hours of 120 credit hours, a nursing program credit hour, 60 credit hours for a nursing degree.
Do I have a motion?
Madam Chair, I'll
This
make
is-
the motion.
This is Michelle Charles, second.
Okay, so Michelle, Christina, did you make the motion and Michelle second?
I think that's how that worked. Yes.
Okay, that sounds good to me. So any other discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Thank you, Mary, for your time.
Thank you very much.
Next on the list is Kansas City, Kansas Community College ADN Program.
Colton Susan Anderson will be presenting that. She will actually have the next 2.
There you are, Susan. We see you.
Good morning.
Okay, we'll let you go ahead and tell us about your major curriculum change for ADN program. We'll do that one first.
Okay, for our ADN program, we would like to request 4 of our classes that we would have the ability to, they're currently offered face-to-face, and we would like to be able to offer them face-to-face or online. It doesn't mean that these will always be online, but we would like the option to sometimes possibly offer them online. The rationale for this is our students have requested a little more flexibility with delivery methods. And we found during the pandemic, when we were forced to be online, that we did very well with this. We had lots of support from our college, and our faculty are well prepared and have lots of great technology to implement this. So the 4 courses we have selected are our 1 credit pharmacology, our first pharmacology course, our 3rd pharmacology course, that's also 1 credit, the health assessment course, but that would be blended. We would do our didactic portion online, but we would practice on ground face-to-face in the lab for that. And finally, our management of care leadership course. Well, it's a 3 credit class that we would offer the didactic portion face-to-face or online.
Thank you for that. Any questions for Susan? Hearing none, Michelle, I guess we're ready for another motion.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Kansas City, Kansas Community College ADN program to reformat the delivery method of 4 nursing courses. NURS 106 Farm 1, NURS 108 Farm 2, NURS 193 Health Assessment, and NURS 245 Nursing Management of Care Concepts from face-to-face only to face-to-face or online for all didactic portions. All lab and clinical will remain face-to-face.
Do I have a motion?
Madam President, this is Dee, and I so move.
Thank you, Dee. Second?
This is Andrea Watson. I'll second.
Thank you, Andrea. Motion is second. Any other discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Okay, Susan, we'll let you do your PN program now with your major curriculum change request.
Thank you. So for our PN program, all of our rationale is the same as what I just described for the ADN program. Students would like some flexibility in delivery methods, and all of our PN faculty have all of the technology and support the same as our ADN faculty. So we selected 4 classes that we would like, again, the option to sometimes put them online. We may or may not do this all the time, but we wanted just a little flexibility. So the 4 courses that we chose was our Ksbn 124, which is maternal child nursing, just the didactic portion. Clinical will be face-to-face. Ksbn 130, mental health didactic. Ksbn care of aging. And Ksbn 132, leadership, roles, and issues. So these 4 courses, we would like the didactic portion. We may do it online, we may do it face-to-face. And we're just presenting that for your consideration.
Thank you, Susan. Any questions for Susan? Hearing none, do I have a motion?
Yes. Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Kansas City, Kansas Community College PN program to reformat the delivery method of 4 nursing courses. Ksbn 124 maternal child nursing, which is 2 credit hours. Ksbn 130 mental health, 2 credit hours. Ksbn 131 care of aging, 2 credit hours, and Ksbn 132 leadership, roles, and issues, 2 credit hours. From face-to-face only to face-to-face or online for all didactic portions. All lab and clinicals will remain face-to-face.
Do I have a motion?
Madam President, this is Christina. I'll motion.
Thank you, Christina. Second?
This is Michelle. I'll second.
Looks like great timing. Michelle was second. So motion is second. Any other discussion? All in favor say yes.
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 Opposed say no. That motion carries. Thank you for that, Susan.
Thank you, everyone.
Moving right along, we'll go to Fort Hays State University DNP program.
Yes, and Colton Jenny Manry is present to make that presentation.
We're keeping Colton quite busy.
I say nothing I can't handle.
Awesome, that's great. Thank you. Okay, there's Jenny. I see your group there. So we'll let you go ahead and talk about your major curriculum change for your DNP program.
Thanks for taking our request today. We have had currently 2 sets of graduates from our BSN to DNP program. We've had 100% pass rates on both of those, and at a year out have had 100% employment in both of those cohorts. So we have great outcomes, but we always feel that one of the strengths of our department is quality improvement and looking at what we can do better. Some of these changes came as a result of the fact that when we created our DNP program, we created it from our master's program that had been in existence for years. So things that had been in that 52-hour program for years and years, we brought forward, and then we added on the doctoral part. Now, as we have grown and had new faculty come in, it's been a great opportunity to look at things from a different light and say, this may have been in existence for the last 15 years, but it doesn't mean that it's right and are things that we can do better. I know I put in the summary that we were changing our MS into DNP as well, and that the state board does not govern that. I added that just because of the fact that our accreditation body does, and there's certain pieces that you have to keep the same as in that. So I added that because the parts that need to be the same have been kept the same. So the easy things are our preceptorship courses. We have 900 clinical hours, which is a lot, but being in rural Kansas, we have a lot of students that are going to go out and work in rural areas without any sponsoring physician even in the county, and therefore those extra clinical hours really help to prepare them for that role. In the past, we've had 7 different clinical classes, some 75 hours, some 150, some 225, spread over the course of 2 years. And it just made sense, as we talked about it, to change that into 4 practicum courses, each 225 hours that they will take fall, spring over the last 2 years. So they're essentially getting the same number of hours. We've just condensed it down to where the students aren't turning in 7 different timesheets, 7 different evaluations, and so forth. The project classes, we currently have 3 project classes, and they each require 200 project log hours. And when we created it, we had anticipated, they're going to each require 200 project log hours, but we think that the second 2 are going to be easier. In our feedback from students, alumni, and on program exit surveys, they have certainly noticed that they all require the same amount of work, but they're getting different credit hours for that work. So we're changing them to where they each are getting the same amount of credit hours. As we look at the classes, we had Nurse 955, which was evaluation of healthcare management, evaluation management of healthcare systems. We also had 814, which was healthcare policy and cost. And ironically, while you never intend to have overlap, we've had trending assignments and cost assignments in those classes that have turned out to be almost identical and just a lot of overlap. So we have removed 955 and we have turned 814 into 914, which will become a 3-hour class. We've done that because 814 is in our master's program, which is our nurse educator and nurse administration program. It doesn't cover things such as independent practice and some policy things that are at the nurse practitioner level. And by turning that into a DNP course at the 900 level, it will allow us to focus on those things more. 620 was epidemiology. It was actually offered out of our HHP class, and 912 was health promotion. Both of those classes were just classes that students felt were outdated and needed to be updated. We've changed that into 945, which is going to be population health. And we feel that with the advent of COVID and everything we've learned over the last 2 years, we'll be able to roll health promotion and epidemiology and different things about population health and populations into that class. And we're really excited about that. So I think the only other thing is that 916, which is our roles class, you can see we're moving that also from being at the beginning of our program more to the end of our program, and we're bumping that up to 3 credit hour classes. While we've had 100% pass rates, we spend a lot of time preparing our students to take national certification exam. And as we do that, it seems that the #1 area that they consistently do the poorest in is professionalism, ethics, all of those roles type things. And we think it's because we're giving it to them at year 2, well before they are ready for it, and they're not remembering it by year 4. So we're bumping that up to a 3 credit hour class, and we're offering it at the end of the program. So by the time they go out, they need to be getting contracts, they need to be knowing what the Nurse Practice Act says and understanding all that information. They're not, I don't remember that because I took it 2 years ago. So does anyone have any questions?
This is Patsy. I have one question. When you refer to pass rates, you're talking about certification pass?
Yes.
Okay, thank you. Any other questions for Jenny?
Oh, I did have just I missed a couple courses, I guess. We also had just a couple classes that we had bumped up that I were at the bottom of my list that I looked down. So we just bumped up 903 and 935. 903 with our health assessment class. It's always been 2 hours for probably 15, 20 years. And we decided to bump it to 3 credit hours because 2 hours just is not enough to teach health assessment. And then 935 is our pediatric class. We've pulled the pediatric content out of different other areas in the program, and we bumped that up to 3 credit hours to have a PEDS class that is 3 credit hours. So sorry, go on. Is there any other questions?
Yeah, Jenny, who do you have with you there on the screen?
Sorry. This is our program director for the DNP program, Michelle Vanderwing. So
nice to meet you, Michelle.
Nice to meet you. Thank you for having me.
It's good to have that kind of backup, huh, Jenny?
Yeah, you can tell she's pointing out you missed these 2 classes.
We all need that help, including me running the meeting. So any other questions we have for the group? Then Michelle, we need a motion.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Fort Hays State University BSN to DNP program to change the curriculum courses and restructure clinical preceptorship courses, but not change the overall credit or clock hours of the program.
So do I have a motion?
This is Juliana, and I'll make that motion.
Thank you. Do I have a second?
This is Andrea Watson. I'll second.
Thank you for that. A motion is second. Any other discussion? All in favor say yes.
Yes.
All opposed say no. Any abstention? That motion carries. Thanks for that.
Thank you.
The last one I have on my list is North Central Kansas Tech and Beloit, the PN program.
Yes, and Melissa Crump will be back should be back to present that change request.
Hi, can you hear me?
We can. You want to go ahead and explain your major curriculum change request for your PN program?
Before we begin, I think I might have got a little ahead of myself because with this, I wouldn't want these changes in effect unless we had the approval for the 1+1. So Janelle, correct me if I'm wrong. Should we defer this until at least the next meeting?
And I may have to ask that question. They're requesting changes to the PN program that will be kind of dependent on having approval for the ADN program, because the changes will make it more consistent with the one-on-one. So it sounds to me, Melissa, like what you're saying is you would not want this request to go through unless your ADN is approved.
Correct.
So, Madam Chair, it may be that this does need to have a deferral if they need to find out if the ADN program is approved after the site visit. Then they can bring this forward with a change for their PN program, depending on that outcome.
I think that's a good plan because I did have a note here. How does this work with the new ADN? So we'll probably know how to answer that.
Sorry, I was thinking about it. I was like, oh my goodness, I really jumped the gun on this one. So.
Well, and I didn't think about that ahead of time, Melissa. You are exactly right. That was a good call.
You're pretty special. Most of us aren't that far ahead of the ball game, so I appreciate that.
I wouldn't go that far.
Recognition. So we'll just move this to the next meeting.